Tonight's presenter is Stephen John. Dr. Stephen John has been a practicing periodontist in San Mateo County for over 35 years. He completed a postdoctoral periodontal program at University of California at San Francisco in 1986. Dr. John is a member of the American Academy of Periodontology, California Society of Periodontists, American Academy of Implant Dentistry, Academy of Laser Dentistry, and several other associations. Dr. John is a fellow of the Pierre Fauchard Academy, World Clinical Laser Institute, and the Academy of Dentistry International. Dr. John implemented laser therapy in his office about 10 years ago and appreciates the advantages of the use of laser therapy in the treatment and outcome of his patients. Dr. John has served as a lead CPR instructor with SMCDS for over 30 years. He's a recipient of the SMCDS Board of Directors Award and Community Outreach Award. Please welcome Stephen John.
Tonight is all about me trying to explain to you what lasers are all about. So it's not kind of the big giant mystery, all right? I'm not here to sell you laser. I'm not here to tell you which is best and what isn't best, because all lasers are actually good, which is actually good news, okay? So what I'm here is I want you guys, when you're all done, to say, I get it. Now I know what lasers are all about. Okay, so let's go for it. Okay. Finally, we're going to have somebody that can tell us about lasers, right? I mean, what happens? Somebody comes in and says, oh yeah, well I got a laser and I can do all this work. Okay, that's kind of like saying, why drive a car when I can drive fast? Well, what kind of car do you have? Okay, so same type of a thing or concept. I've been around for a while. I think Rich is the only one who's been here longer than me. Oh, that's right. I'm sorry. You guys have actually been around longer too. Okay. So I used to say that actually I started doing perio in 1961. Well, actually my dad did, but of course I learned by osmosis. So you guys know that, right? So if you have a family member, Adam, where are you? If you have a family member, you do realize that you've been practicing. How long have you been practicing, Rich? Yeah, you've been, so now you can claim the fact that you've been practicing that long. And people have to believe you, by the way, because you have been, it's through the osmosis. Anyway, what got me started in the lasers is that most of you guys knew my dad, right? My dad was a Washington graduate, and basically Washington graduates known as the bone assassins. If there wasn't bone particles on the ceiling after surgery, you didn't do a good job, okay? And that's not a joke. I mean, literally, like okay, I flapped it, great, pull out the drill, and like, there's like stuff flying all over the place. Ultimately, most patients don't like that. While they get great results, they never want to have the surgeries ever done again. Okay, so that's number one. Number two is that it hurts so much, they don't ever want to have that going. So I try to pick the conservative niche. I went on the other end of the spectrum. He's a yin, I'm the yang, all right? So the idea is everything that I did was designed to be as conservative as possible, to go ahead and do more root planing, more conservative therapy, minimal flap reflection, things of that sort. So I spent my whole entire time trying to figure out how to be as nice and kind to the tissues and to the patients as best I can and still get the same results that he got. I got to tell you, that's a really difficult thing to do because he got some great results. Those Washington grads, they really know what they're doing. Okay, so that's how I got started in lasers. Ultimately, I said, hey, this seems like something I want to do, what I want to get into. Started to go ahead and look at the ideal lasers, did my research. There's not a single laser company I didn't research. I went ahead and looked at every single laser company out, every single what was out there, the options, the companies, things of that, before I made any sort of big purchase. Actually, there's another story behind that, but I'm not going to bore you with it. One of the things, we've got a lot of stuff to go over tonight. So here's the thing. Lasers are extremely complicated and is a huge subject. It's really not a simple type of discussion. And a lot of you guys are going to end up saying, well, what's the best laser out there? Well, I got to tell you that it all depends upon what you end up wanting to do with it. So I'm going to be talking a lot. If any of you need me to stop or to kind of clarify something, please feel free to do so. Yes, I actually lecture for BioLase. So am I biased to BioLase? I bought a BioLase laser. I go all over the United States, and if you guys bought a BioLase laser, I would probably be the one that would train you guys on how to use it if you do surgical types of therapies. Myself, the head dentist of the company, and another periodontist in Texas, we go all over the United States to train doctors how to do it. So I kind of know what I'm doing, even though I'm not that good at it. I'm kidding. I hope I am, anyway. But I am trained this. Today's not about BioLase lasers, and I want you to realize that. This is not about BioLase. This is about lasers in general. There's a lot of great companies out there, a lot of good lasers out there. And so I'm going to tell you right now that if you after tonight you go, hey, I think I want to incorporate laser therapy in my practice, do your research. Look at the companies. Go to the different companies and find out. Have them bring in the laser. Talk to them about that. Because they're all very similar, but they're also very different. And it's up to you to go ahead and look at this stuff and to be knowledgeable about what lasers are all about. All right, so bottom line is, with the laser, if you tell me what you want to use the laser for, if you say, I want to do the following techniques or the following procedures in my practice, I can tell you which laser would work best for you. So not one laser is ideal for every single doctor, every single practice. So when you come out of this, that's what I want you to start thinking about. If I got one, what do I want to use it for? So it's a tool. All it is a tool. It's not a magic wand. It's not going to go ahead and create any sort of better outcome. It's going to make life a little bit easier for you, as you're going to kind of learn from a little bit later on. Like, I can do better procedures because I can see, because there's less bleeding, I'm more efficient, but it's not a magic wand. It's how you use it. It is purely a tool. Now, when we get involved with the idea of PBM, photobiomodulation, that is the magic wand. So photobiomodulation is a whole nother subject, which actually I'm not going to go into tonight, that is all about wound healing, okay? So you can actually utilize laser therapy, and it's actually done in medicine, where at various sorts of levels, you can establish bioinhibition and biostimulation, okay? That's a whole nother subject, and I'll be honest with you, it still is in research, it's still being evaluated. The Academy of Laser Dentistry has billions of people working on what is the best laser, what is the best wavelength, what are the best components to it to go ahead and get the optimum photobiomodulation. Okay, so just to let you guys know. All right, so ultimately, laser therapy. What do you need to learn from tonight? We need to learn two things. Number one is basic biology. So when we talk about a procedure, a surgical procedure, things of that sort, we want to know about basic biology of why we have success and why we have failures. You cannot forget all about why we have success and failures, okay? In addition, we have to understand what each laser does. You're not going to pick up a dial laser and start to go ahead and cut on a tooth, okay? And so you have to understand what the different types of lasers can end up doing, okay? Again, I already said that. It's not going to make you a better dentist, okay? But the thing about it is that with laser therapy, and this is, I'm going to give you my punchline right now. With laser therapy, one of the things that it does is it does help in the hemostasis. So if I'm working on a patient and doing surgery, if I have a scalp and curette and it's bleeding everywhere, I can't see what I'm doing. Most of the time in utilizing laser, we can get better hemostasis, and I can get better visual look at the area, so hopefully I can be more efficient. If I'm going to go ahead and do root debridement, if I flap it, if it's bleeding everywhere, I can't see that calculus. But if ultimately by flapping it, I can see that root surface more efficiently, I can be more efficient at removing the calculus. So that is how it can make me a better periodontist. Not the fact that it's going to make me any better, but I can get better visualization. I just did the punchline. If you guys want to take off right now, go right ahead. All right, so here's the thing. So one of the biggest complaints that people have is if I say that we do lasers, the people that want to challenge, okay, the ones out there that are going to say, ha, Steve John's going to come in and I'm going to challenge them and say, show me the literature, show me the article, show me that research article that says that you get a better outcome by going ahead and having the literature for it, okay? First of all, it probably doesn't exist, okay? Why does it not exist? Because I already said, the laser is a tool. It's purely a tool. It'd be like me going over and saying, so show me the literature on whether or not your Midwest handpiece is better than your Cavoy handpiece. They're both handpieces. They both do the same work. One may claim that they're better than the other one or something like that, but they're both basically about the same, or they have slight differences. The piezo versus the ultrasonic. Some people have preferences of one or the other. Okay? So it isn't the fact that actually one is more effective and efficient. It depends upon in your hands what is more effective. So one of the things about the idea of research is, and I'm trying to explain to you right now, It's all about, the only research you need to know on lasers, is it safe for the tissues? Is it safe for the therapist? Is it safe for the patient? Does it accomplish what it needs to end up doing? You're not going to have a better surgical outcome because you use a laser. You guys catch me on that one so far? So a lot of the times the biggest argument, particularly with periodontists, we are such jerks. Periodontists love to go over and say, well, show me the research. Okay. Problem was, a while back, there was a laser company that actually a periodontist kind of got involved with, that they're doing basically non-surgical therapy and showing some great results. So everybody is saying, show me the research on that, things of that sort. The problem is that again, it has nothing to do with the idea of the research of predictability, things of that sort. Unfortunately, there's nothing really predictable out there. Okay, in other words, in treating periodontal disease, you guys already know that, and you're going to have to learn it. It's like a hard fact. Periodontal disease is not predictable, the treatment of it. We have many, many, many different types of treatments we can do, and the reason why we have it is because if one doesn't work, we go ahead and try another one. All right? So, but laser therapy in some situations does allow us to get a better outcome by doing the therapy. In other times, it doesn't. It's not necessarily predictable. So part of it ends up being, if anybody's here that says, show me the research, I could show you research where it's going to say it's kind to the bone. In other words, if you want to cut on bone, it's going to be kind to the bone. It's not going to charge, it's not going to burn it. I can show you research that's going to say it's going to be kind to the tissues. It can go ahead and cut tissues. It's not going to destroy it. Okay, and I can also go ahead and show you research that says, is it kind to the pulp? Yeah, it is kind of the pulp. So that part of it ends up being is that you have to go ahead and trust the people whom you work with. You guys all have people have doctors that you work with that you, I mean, like this, the special. All of us have a specialist or doctor that you like to work with, and part of it is because you trust that person to know you're going to get the correct information out there about what's the best treatment for that. They're not going to BS you. And that's the whole point about this, is that it's all about trusting who you're working with and talking to them about what they're making the recommendations for. Laser. So what does laser stand for? Laser stands for light amplification by stimulated emission of radiation. On that phrase right there, what's the one word that you guys pick out? They say, uh-oh. Radiation. And so do our patients, by the way. So patients I've read up on are going to say, oh no, that has radiation. I can get cancer from that. Well, guess what? You can't, because it's not an electron, it's a photon. The photon is a piece of light. It just floats around everywhere. It doesn't do anything. It won't damage DNA. It doesn't do anything. So what's wonderful about the laser is all about the photons. The photons don't cause DNA trauma or DNA damage to the cells. There are a few very important points. Again, tonight's discussion is a discussion. You guys are listening to me right now, but ultimately we will have a discussion because you guys are going to ask questions. Tonight's, there's a few very important points. Number one, lasers. Lasers all have some sort of a medium. Okay? So if you actually look into lasers, you say, well, what kind of a laser do you have? Oh, I have a CO2 laser, very popular in neurosurgery. Okay, I have an ND YAG laser, very popular in dermatology. The medium is ND, which is YAG, which is something else. Anyway, that's the medium. It's a solid. If I apply an electrical stimulus to that medium, whatever it's CO2, ND YAG, erbium, chromium, YSGG, which is what the bio is, erbium YAG. Okay, argon. If I have a diode, okay, the diode is actually this cute little electrical unit that they figured out. I have no idea how they did it, but if they put like this little electrical impulse in there, it actually will create a photon depending upon the ohms and this and that. Anyway, I have no idea how that works. But anyway, somehow it comes off where it creates a photon at a specific wavelength. So what will happen is that if I apply an energy to a medium, so if someone's going to sell you a laser, what laser do you want me to buy? I want you to buy a CO2 laser. That's the medium. And I can tell you already, if you have a CO2 laser, what the wavelength of that photon is. Because a medium has a very specific wavelength. It doesn't change. That's the wonderful thing about wavelength, about the mediums. They have a very specific wavelength, okay? And that wavelength has a certain effect on the target tissue. In dentistry, we have literally wavelengths, most common, 700 up to the 10,000 range. In through here, okay? Actually, by the way, that is laser. Did you know that actually has benefit? I could take my laser pointer, I could point it at my gums, and it can actually have photobiomodulation capability. And did you know that I could go ahead and have one of these in my office and I could advertise I do laser dentistry? Seriously, you can. You can take that and you can point and say, I do laser dentistry, okay? Which is why I'm going to emphasize, if you guys get involved with lasers, please know what laser you're using, why you're using it, and please also the fact to put it on your website and tell the patients what you have and explain to them why you have it. You're not a laser dentist, unless you have a whole bunch of them like me, okay? So it's like, I got, I think 6 lasers. Yeah, I think about 6 of them. My wife is so pissed off when I bought my 6th one. What'd you buy that one for? Never mind. So anyway, so the thing is that each one has a purpose, and it will tell you what you're going to be doing with that laser. It's going to tell you what procedures that you end up wanting to do, and that's why I have so many different lasers. Okay, so in dentistry, here's our range. All right, so I actually have young children. I know, is that weird to think I have young children? Yeah, so I actually have an 18-year-old, I have a 12-year-old, and I have a 9-year-old. That's why I can run around like this, is because they keep my energy going. And then I crash out late at night. I used to joke by saying I gave my 9-year-old some crayons and he drew a picture on the wall, and I took the picture and said, look at that, look what he did. This actually is one of the in lasers. This is the most important diagram that you can find and see in lasers. When talking about laser therapy, we'll talk about lasers. The absorption coefficient. Okay, so what is that telling us? We have hemoglobin, we have melanin, we have proteins, we have water, we have a hydroxyapatite. All the stuff found in the oral cavity. Woohoo! You want to take a picture? Cool, go for it. Okay, all the stuff found in the oral cavity. All right, now, let's say by chance you said, hey, Steve, I want to start cutting on some teeth. I'm going to go ahead and buy one of these cool lasers over here. What do you think? I'm going to say, no, you're not. Why? Not because it's not a good laser. These are probably great lasers. I mean, I'm kind of going, these are kind of cool looking here. Anyway, so these are great lasers, but it doesn't do what you want it to do. So in looking at the chart, an A10 laser is great at hemoglobin, melanin. A 970, 980 is good for the same. 1064 laser. Okay, who here has heard about the Millennium, the Periolase laser? You guys familiar with that one at all? So Millennium was actually the company that they came out with one of the first lasers that was accepted in perio, and it's a 1064 laser. And are you warm too? It's kind of warm, isn't it? Is anybody else warm in here? Is that okay? See, unfortunately, I'm one of those people, like if you put it down to like 45 degrees, I'd probably be a happy camper. Anyway, partly because of the fact I've gained so much damn weight. Anyway, we're not going to talk about me anymore, though. So the deal is that depending upon what the wavelength is, remember I said you want to know about CO2 laser, what the wavelength is? What the wavelength is going to be its affinity to these different components. 1064 is the top range of the, did you get that? Yeah. Okay. No, that's okay. So 1064 is again the top range for what's called the pigment melanin. And then we get into the ones over here, hydroxyapatite and water. Okay. Now, a lot of times people say, ooh, I want to get a laser that's way over here and it does great with water and does great with hydroxyapatite. Ironically, that's where the CO2 lasers are. Okay. Did you ever use a CO2 laser, Rich? Did you ever use a CO2 laser? How about you, Bruce? Okay, CO2 lasers are wonderful. They're great. The only thing about CO2 lasers, the original ones, is that there's only two things bad about the original CO2 lasers. Once they cut the tissue, they're like, woo, that was easy. I want to go to the next tissue. So if you don't have a barrier, if you don't block it, if I'm going to do a biopsy of the tongue, next thing you know, I'm doing the cheek, I'm doing this, I'm doing that, and then I'm biopsying the wall. So in other words, the CO2s, the original ones, they just kept cutting and cutting and cutting. They're great. They're fabulous, wonderful. The other bad thing about it is because they're so dang efficient, you touch the tooth, and that tooth would shatter. Is the coolest thing. You put on a tooth, it just blew up on you. Okay? So it's so efficient that it really didn't work very well. Okay? Fortunately, another company, I don't like mentioning companies' names, but another company for CO2 laser came out with the CO2 that they were able to take an isotope and they're able to take little servers to make that laser move around. So it doesn't do that. It doesn't blow up the tooth and is actually fairly decent, fairly good at cutting the soft tissues. It still, once it finds its target tissue and it gets rid of it, it still wants to find the next one, but it's a little bit safer than what the other ones were. So in dentistry, we really have two main types of lasers. Okay, I'm making this simple now. We have the pigment hemoglobin seeking lasers, and we have the water hydroxyapatite seeking lasers. Okay, so the common hemoglobin are going to be your diodes. Almost every company has a diode out there. It's the most common lasers out there is the diode lasers. And they all have different types of components and things of that to it. Okay? The other type of laser is the water hydroxyapatite seeking laser. Okay? These are looking for water, trying to find water. If your tissue doesn't have water, it will give it to them. And these are great at cutting not only soft tissue but hard tissue. So if you want to do a cavity preparation, if you want to go ahead and cut on tooth, if you want to cut on bone, and I know because I just had a surgery that I finished 4 hours ago. Oh my gosh, I was totally like whacking with the bone. So my wife is actually assisting me right now because we don't have an assistant. Anyway, so she was like she was funny because she's like she hasn't really been around the lasers very much. And she actually said in the middle of surgery, "Whoa, that is cool!" Because you can see it literally melting away the bone and stuff like that. It's the coolest thing ever. Bottom line is, so then you have these. Now, these are obviously a lot more expensive. You're probably looking to the cheaper ones, maybe about $65,000, $85,000, up to about $120,000 or so for that one. What? Why would I want to buy that? Well, actually, you may want it. These, on the other hand, can be a lot cheaper. You could actually find a diode, by the way, for like about $1,000 maybe. Don't get a $1,000 diode. Or they can go up to about 10, 12, 15,000 or something like that. Okay. You can also get a diode laser that I think is right around $25,000, $30,000, $35,000. Okay. So why is there such a big difference? Partly because of the fact what the lasers can do. I always like to use the analogy. You can either go ahead and get a flip phone, hello, are you there? Or you can get a smartphone. Now for most of us who've had phones a while back, I don't need a smartphone. All I want to do is call somebody and flip up the phone and give them a telephone call. But we've all bought smartphones. Why do we buy the smartphone? Because our application of the smartphones we say we'll never use now, we use all the time. And the same thing happens with your diodes. So anybody who's thinking about getting a diode, we'll talk about that in a second if it works for you. I'm going to tell you right now, don't go cheap. Go for the bells and whistles. Ultimately, depending upon the laser, okay, you guys are catching me on this, the fact that there's different types of lasers out there, right? And you guys are now understanding that we have two main types. The soft tissue, pigment-seeking lasers, and the soft tissue and hard tissue, water-seeking lasers. So within that, we have a few other things that can happen. Okay, cut the tissues. There's that, remember those micro explosions? They create what's called photoacoustics. Lasers. I'm going to go over basic lasers out there. And when I did the one slide when I compared them was literally about 8 years ago. I'm going to tell you right now, as you already know, is that every year new companies come up with new lasers. Every year existing companies come out with improved lasers. And so the information I'm going to show you is not meant for you to kind of look at the laser companies because that's old information. But what it shows you is there's a lot of information on these lasers that you have to look at. So in dentistry, what do we have? We happen to have the diodes, which are the most common ones, the pigment-seeking lasers. We have the ND-YAG, which again is pigment-seeking. Most common one is Periolase, which is designed for treating implantitis. We have the Erbium-YAG, and we have the Erbium-Chromium YSGG YSGG, and we have the CO2 lasers. These three are the water-seeking. These two are the pigment-seeking. Okay? So what are the soft tissue lasers? Let's say if you said, all I want to do is soft tissue. I don't want to grind on teeth. I don't want to grind on bone. Okay. All I want to do is trim the tissues a little bit. All I want to do is if I happen to have, let's say, an irregular surface, how can I cut that tissue? How can I smooth it off without taking a scalpel or things of that sort? What can I do to be the kindness that I can to the tissues and the least discomfort for the patients? Okay, these are the diodes. So diode, again, pigment seeking, they're a semiconductor. They have little electrical units in there. Okay, they vary, and actually I put the 40 here. You said that yours is 100 watts. Okay. By the way, when we talk about watts, is that the question is how much watts do you? Most of us, I want to buy a Ferrari. Why do I want to buy it? Because it's fast, has a lot of horsepower, and doggone, that's what I'm going to have. I'm going to have the best car out there. Does it make me a better driver? Does it make me don't know? It's because I like it. We don't always need higher power. But there are times you may want higher power or the capability of higher power. In addition, which I'm not going to go over, is we talk about watts, is that the watts a lot of times have to do with what's called the peak power. So I could say that I have, let's say, 1,000 watts in a laser, but when you look at when that goes for a very, very short period of time, it's actually only a 3-watt laser. I'm not going to confuse you guys with that. All I'm saying is that when you talk about watts, you really don't need a lot of watts to go ahead and get the job done. And most of the time, these higher watts have to do with the amount of peak energy that come out of the lasers. Okay. And in most situations, you really don't want a lot of power unless you're doing certain types of procedures. Soft tissue removal, tooth whitening, sterilization of the pocket, that's basically called LBR, laser bacterial reduction. Now, what about you guys? That's nice, Steve. But I want to go ahead and think about the idea of cutting teeth. I want to think about cutting bone. I want to go ahead and open up that area and cut some bone up. Yeah, that smell of burning bone, man. It makes me drool. Anyway, so I mean, if you want to be more aggressive, cavity preparations. How did I get involved with cavity preparations? Because we have external resorption that's subgingival. So I will flap it over and go, oh, cow, there's like a huge cavity in here, a huge resorptive lesion. So I've got to remove the resorptive tissue. I've got to clean up the margins of it. I've got to etch the surface. I've got to put some Gerastore on there in order to go ahead and get it to seal up. So we're back to CO2s. Wait a minute, Steve, you just said it doesn't work. Well, there actually is a CO2 laser out there, and I will mention the name Solea, okay, who came out with the CO2 laser. Interesting because actually, one of the head guys in the marketing area used to be the head guy in Invisalign. I actually knew him from Invisalign because he used to lecture for Invisalign, and he came to me and said, hey, Steve, are you interested in this laser? I was already working with BioLase, and I go, no, and so he told me all about it, so I became pretty familiar with it. Anyway, so it actually is, again, it's a great laser. If you're doing restorative, if you're doing cavity preparations, if you want to use it primarily for restorative, it's wonderful laser. It's very efficient. If you want to go ahead and utilize it for soft tissue management that you can see, it does a pretty decent job.